WFMP 1065 Forward Radio began broadcasting here at the historic Hayburn building 5 years ago this April. Stay tuned for our celebration plans. Now, before we flip the switch, planning, organizing, and fundraising began about 5 years before that. Big thanks to John Hartman, who brought the idea to the steering committee of the Louisville chapter of the Fellowship of Reconciliation. And Jenny Welsh, Matt Lane, and a team of volunteers from WRFN in Nashville were up multiple times, lending invaluable assistance, helping us navigate the low-power radio system. None of us really had backgrounds in radio. The Hayburn building team, Cindy Euler, and our current point person here at Hayburn, Larry Wright, helped us kick off, and 5 years later are still so helpful. And last but not least, Louisville FOR. They took a big gamble on our working group's vision for an all-volunteer radio station. Thank you, Louisville FOR, and special thanks to the late Tim Sheldorf, who worked tirelessly to help us make it happen. WFMP 106.5 Forward Radio does not endorse any particular candidate or pieces of legislation, but we do endorse the need for an informed electorate. As such, we offer equal airtime to all registered candidates for any particular office, and you can get in touch with us at forwardradio.org. The following is a recent candidate interview recorded at the station's Community Access Hour. I'm Mark McKinley, a volunteer with the station. I want to let our listeners know that the views and opinions expressed here on the show are those of the speakers and not the station. Other candidates who are interested in sharing their perspective can contact Forward Radio at forwardradio.org and click on the Contact Us. We are open to different perspectives. This is a nonpartisan radio station. Mike?
Yeah, this is Michael Flynn. Let me begin with the usual disclaimer that any comments that I may make on this program I represent my personal views and do not represent the views of either the University of Louisville or the Department of Surgery.
This is Eugene Shively. The comments I make don't represent the Department of Surgery at University of Louisville, nor do they represent Taylor Regional Hospital in Campbellsville, Kentucky.
We have a special guest today, and this is a first for this program. We have Andrew Owen. Andrew is running for the 9th Metro District Metro Council seat to replace Bill Hollander, who is retiring. And our topic, we're not going to ask, we've had many guest speakers, health individuals talking about an assortment of health issues. And today, we've asked Andrew to try to approach this from a somewhat different perspective so that we can discuss the healthcare issues in a sense that the kinds of the views that the public would like to hear about from someone in public office or someone running for public office. So Andrew, we welcome you. We appreciate your willingness to join us and have this conversation. And as we've done with our other guests, we're going to give you an opportunity to make whatever comments you'd like for as long as you'd like. I would suggest you introduce yourself and give the listeners an indication of why you're running for public office. And after that, then we'll get the conversation begin. So the floor is yours.
Great. No, I appreciate you guys having me. I am Andrew Owen, and I am running for the 9th District Metro Council seat. And by trade, I am own a small business and am a kind of an incurable entrepreneur. I own Preston Thomas Properties, which is a commercial investment brokerage and management, commercial real estate investment brokerage and management company. My background academic background is in history and urban planning and finance and real estate. So as you can tell from that, I am not an MD or a master's in public health. So my opinions on single payer healthcare and other issues related to healthcare are only informed by my own curiosity and not by any specific training. So I'm running for 9th District Metro Council in part because I think this part of the city, these neighborhoods that are in the 9th District, are the best neighborhoods in the city. And it would be an absolute honor to represent the people of those neighborhoods at Metro Council. I've lived in a number of different neighborhoods in Louisville, great neighborhoods, have great people, great history, great housing. But when my wife and I decided to leave Belgravia Court in Old Louisville, which was a difficult decision because we loved it there, the choice of where to move was pretty simple. And it was really related to the number and quality of local businesses, local shops, local restaurants in the 9th District. And that's what I think separates the 9th District from any other neighborhood in Louisville. I'm going to be focusing on a couple of things. The core of the job of Metro Council, and something that you have to do well or you won't have the space to do anything else, is constituent communication and constituent services. And so that has been all of the representatives in the 9th District for decades have been very, very strong in that regard. And the expectations of the residents of the 9th District are very high in that regard. And so that will be, the primary focus of our office, to continue offering high level of service and communication. We also want to make sure, especially in a post-COVID world, that we support the local shops and businesses along Frankfurt Avenue, in St. Matthews, along Brownsboro Road and Lexington Road. This is a different world that we're living in post-COVID, and we're not immune to boarded up shops and boarded up places like has happened in other parts of the city. And so I want to make sure that the St. Matthews Chamber of Commerce has the resources that it needs, and the Frankfurt Avenue Business Association has the resources that it needs to support those local businesses and make sure they continue to thrive. And we can do that a number of ways programmatically, but we can also do that by making sure that the public infrastructure along those business corridors is as good as we can make it. And that includes small things like curbs and sidewalks and signage, and making sure that crosswalks that have faded to the point where you can almost no longer see them are repainted. Make sure that there are plantings and things that make people want to be out and about and walking in those business corridors and spending money in those local places. And then I would just say also that from a metro perspective, you focus on taking care of the people in your district, but then you have the opportunity on the Metro Council to help shape the future of the city of Louisville. And we have a lot of issues that we need to address, but from my perspective, many of the issues that we have can be mitigated in part by focusing on social equity. And that simply means investing in the people and places and neighborhoods that have the least political, social, and economic capital. And so I'll leave it at that. That's kind of generally where I'm coming from and what I'm hoping to do.
Great. We appreciate that very much. And so what we're going to do, we're going to focus on health issues rather than sidewalks and things like that. Now this is the social equity issues are sort of fundamental to healthcare. So Gene, I'm going to let you fire the first round across Andrew's bow, and we'll get the ball rolling.
Okay. Well, one of the problems that all governments face is health insurance. And does the cost of health insurance, particularly with the increased costs with for-profit health insurance company affecting metro government? And how do you think we can solve that problem? I'm sure it affects your own business as a predominant cost.
Well, from my specific perspective as a small business owner, I'm one of those unfortunate people who are in the marketplace, right? So I'm self-employed and I'm out on the health marketplace paying for very, very expensive and not very good insurance for my family. So I certainly have that perspective, which is really the last place you want to be in our current health system environment. But from a metro perspective, and I was asking around a little bit about this, I have the metro budget, the approved metro budget in front of me from 2021. And we spent $51 million on health insurance for metro employees. My understanding is that they call it it's being self-insured, but basically what that means is that the employees of metro government have their own pool that are insured. And so a few years ago, when we had within that pool of employees, which I think is about 5,000, we had a number of claims within that pool. The price of insurance for the city went up that year. And so it was variable based on the health needs of that pool. But the question that came to mind for me was, what if we move to a single payer system and the federal government is paying for health insurance for everyone in the country? Would that $51 million line item in the metro budget go away? And it's a very interesting question. My own answer, without a ton of being really informed, is that would go away and we would have $51 million to do other things with that. Now, that's not to say that the federal government wouldn't try to claw back some of that from other ways, but what a huge boon that would be to both Louisville and other cities and states across the country.
Yeah, almost every other first world country has figured out a way to do something like that allows the government to provide health care as an essential public service as opposed to a commodity. And, and if you think about, Medicare has a 2% administrative cost, and 98% of that money goes to provide health care. And if we could establish some kind of a national program like they have in Canada, Australia, and New Zealand, it would make the whole delivery system simpler as well as cutting the costs. Now, Gene, you've got some data about where the money goes with healthcare in this country. Why don't you share that with Andrew while we're on this aspect of it, and then we can move on to maybe some other areas.
Well, we spend about $3.6 trillion a year in healthcare, and about a third of that goes to places that are really not healthcare. For example, for-profit insurance companies. We're one of the few countries that have turned medicine into an industry where it's profit-oriented. And we've got this huge cost in administration, huge cost in pharmacy charges. We're the only country in the world that advertises drugs, hospitals, doctors, etc. we even now equity companies owning nursing homes, et cetera. It goes on and on and on. And it's gradually, actually in the last 4 or 5 years, gotten much worse. So we've created a system that doesn't exist anywhere else, and it's costing us a huge amount of money. I would like to go back and ask you one other question. That is, how difficult it is for you as a self-employed person to get insurance, and how that's affected your bottom line and affected you and your family personally.
Well, it's not difficult to get if you can afford it. I mean, that's the issue.
Yeah, if you can afford it.
Pay for it.
I mean, I don't remember the numbers off the top of my head, but I mean, I think you can I think I pay somewhere between $15,000 and $18,000 a year for a family of 4 for very poor health insurance that nobody wants to take. I call them and tell them what health insurance I have, and they're like, ugh. And some people are like, we don't take that. Other people are like, we'll take that, I guess. So it's not great health insurance. It's expensive, and it has high deductibles. So how has it affected my bottom line? I spend a ton of money for bad insurance.
Do you have your own health savings account? Does that help?
It does help, and you can mitigate some of the expense that way. And I do have a health savings account. It's a reasonable tool to use, but at the end of the day, it's just working around the edges and improving what a bad system around the edges, right? So it's expensive, and that helps some.
Let's focus a little bit on some of the issues that the political issues that float around with healthcare in this country today. Andrew, the vaccination issue. I'd like to get your views about it, and unfortunately, I think local public officials have actually got limited ability to change some of these things because of the way laws are written in the legislature. But we've got the issue of vaccine mandates. We've got the issue of sort of recommending vaccinations. In France, you can't go into a bar, you can't go into a gym, you can't go into a restaurant. And one of my older daughters lives in New York, and it's the same thing there. Here, there are only 2 restaurants in town that I'm aware of that require proof of vaccination before you can eat there. The other day, I was calling around at a couple of athletic facilities. I resigned from the Y during the beginning of the pandemic, and I was thinking about rejoining one of them. I'm not going to mention the names. And neither one of them require any sort of proof of vaccination, and they're doing this sort of wishy-washy, well, we recommend everybody does that. So let me just pass this over to you. I think it's a difficult question, but these are the kind of issues I think that the public would like to hear about from somebody in public office. And could you give us your views? You got vaccination in schools, restaurants, gyms, you name it.
So if there is one place where the government ought to be able to mandate certain things, it's related to public health. I mean, and what form that takes, that's, I think, open for more debate. Do you encourage people to get vaccinated and to wear masks? And ideally, of course, you wouldn't have to mandate anything. People would do what's in the best interest of both themselves and their fellow humans. But if you can't get enough people to do that, then again, I'll say it again, if there's one place where you lose your individual rights as it relates to the government mandating you to do things or not, for me, it's public health. I mean, and why is that? Because what you do affects everyone else. And so that's why it's very different than, other laws that are seen as taking away personal freedoms and all of those sorts of things. Because of the way pandemics work, every action that is taken by any individual citizen affects everyone else, which is why I think that's where the argument ends as it relates to, government taking away my individual freedoms. It ends for me with a pandemic, a global pandemic. And so I think it's as simple as that for me.
Oh, I absolutely agree with you. But sadly, there's a lot of people who don't, including one of our senators who has got some of the nuttiest ideas I think I've ever heard. Let's just move from masking to vaccinations, because that the same issue, public health issue. Your thoughts on vaccination mandates versus vaccination recommendations.
Well, let's not forget that we had a problem with anti-vaccine long before this pandemic hit. So this is not a new issue, and it's primarily driven by misinformation, I think, on social media. And I don't know how you fix that problem. Social media is an incredible tool, and it can do great things. But social media it's a horse that's hard to put back in the barn, as they say. So,
well, it's a double-edged sword, clearly.
Correct. And so once anybody can get any message out there, and you can't make that message go away. So I think, as it relates to getting vaccinated, I think, that if I have a private company, I think I should absolutely be able to require people that work for me to be vaccinated or not. I think as a government, I should be able to require people to be vaccinated. And how far that goes, those seem to me like obvious steps as it relates.
Well, it doesn't go to Texas, so you better not.
Well, no, I understand that. I guess I mean like whether you require universal vaccination or whether you require just vaccinations related to employment contracts. That's what I meant by that. But you're absolutely right. It doesn't go to Texas and other places.
We have I think 30 million people in this country who are not vaccinated, and they keep the pandemic going. The virus has a place to go. They get sick. They go into the hospitals that are overloaded. They end up in ICUs, on ventilators, and dying. And it's just astonishing to me that there's so much inconsistency in the messaging from the politicians in this country, including in the state of Kentucky.
That's a really good point, Mike. I mean, I think you hear so much as it relates to guns and gun control, but also other things about people trampling on my individual freedoms. But where's the counter argument? Like, if you have your individual rights to have COVID and go wherever you want, whenever you want, and get a bunch of people sick, where does that individual right of yours not to be vaccinated and not to be masked, for example, start trampling on everyone else's individual rights to feel safe and be healthy? And and it's the same thing with the gun control argument. Your right to have a military style weapon, is trampling on my right to feel safe. And I don't think there's enough pushback when it comes to where one person's individual rights start and stop as it relates to somebody else's. To me, it's a very important place where we should be pushing back. Again, this whole country is built on individual freedoms and property rights and all of that. And I'm not questioning that. But there are degrees, and that's, where you draw the line on these things. And to me, when somebody else's individual freedoms, as they want to call them, start trampling all over my individual freedoms, somewhere in there is a line that needs to be drawn.
Well, I've
Well-
read the Second Amendment. It's very clear. It's only about 2 lines, and it begins with a statement about a state militia, not some guy driving around in a pickup truck with an AR-15. Let me ask you, what kind of what is the local situation in terms of the ability of the Metro Council to regulate or control access to guns? I know the state has got all kinds of crazy ideas about people carrying guns into the into the legislature if they want to, but where's Louisville?
Well, let me start with what I think is the most egregious issue as it relates to buying and selling guns, and it's kind of referred to as the gun show loophole. I had a conversation this morning with a member of the Metro Council, and we were talking about a lot of these issues. And he was saying you can go right across the street here to Freedom Hall, and you can buy backpacks and duffel bags and trunks full of weapons, and no one will ask you for ID. No one will ask you. It's an absolute free-for-all. So right there, what seems to me like an extremely common sense piece of gun legislation would be to close that gun show loophole. And that the polling numbers on that, for example, are through the roof for, both parties. And yet it hasn't happened and doesn't look like it's going to happen anytime soon. But right there, you can just buy boatloads of ammunition and guns without anybody asking any questions.
Now, is that issue not addressed because of state regulations or state laws, or is that not addressed because of issues of the Metro Council not having solidarity on that?
I think it's not. I don't know for sure. I have to be honest. I don't know for sure, but I think that is state legislation that. I'll give you some examples. The reason I say that, and these are different states, but I know that, for example, Chicago had, stricter gun rights or stricter gun controls that were thrown out at some point by judges or the state of Illinois. So I think they've, at the state level, they've made it so local jurisdictions cannot pass any gun legislation that overrides state law. I think that's where the issue is, and not something as it relates to Metro Council people not being able to get on the same page.
Yeah, Gene?
Going back to mandates, mandates is not a new issue. George Washington demanded that his soldiers get vaccinated for smallpox. The British had all been vaccinated, been exposed to smallpox, but Americans had not. And so we were losing the war, so he mandated that all his soldiers get vaccinated for smallpox. In 1905, this issue came up again, and it went all the way to the Supreme Court, and the Supreme Court decided for public epidemics that you had to be vaccinated. So we've forgotten how serious and what a big problem these are. We have mandates for rubella, for we used to have for smallpox and polio, for diphtheria, tetanus, but for some reason we've made COVID a political issue, which I don't understand.
Yeah, Andrew, let me on that same issue of mandates versus recommendations. Now, I read an article in the Courier Journal in late January, which focused on the COVID issue in public services, the garbage collection, public safety, the jails, low vaccination rates in the police, the fire department, EMS, and Metro Corrections. And, for the life of me, I don't understand what is in the heads of everybody from a policeman to a fireman. Someone works in the jail. I know this is a hard question, but we're talking about health issues in public office. So what do you think?
I won't pretend to know what's in those people's heads, but let's talk about it in terms of how that affects how much money the city has to spend on certain things. Let's talk about it in terms of you've got a certain number of city employees, whether they be police or any number of corrections or EMS or whoever that you just mentioned, and you have a certain number who are unvaccinated. You have a certain number who get sick and have to take time off. Who does that cost? That costs the metro government and the taxpayer. So these decisions that are being made have consequences that affect all of us, right? So I mean, these are not things that one guy or gal makes a decision and the consequences are all visited on them and them alone. No, those are all decisions that affect all of us. And you can point to the cost of healthcare. You can point to the cost of people being sick and needing time off. And, you know, they stopped picking up yard waste. And then part of that was because they didn't have enough people to do the job. So
I remember
that there are consequences to these individual decisions.
So how can we solve that problem?
Yeah, well, before you answer that, the article, 55% of the police were vaccinated, 50% of the fire department, 50% of TARC, and 51% of Metro Corrections. And, you know, as Gene said, how do we solve the problem? I guess I would ask you, you know, at least in my opinion, the government needs to have a strong stand on this. I know it's difficult dealing with the police unions because they've got some nutty ideas about a lot of things that, I mean, I think being a policeman is a very, very difficult job. And, you know, the candidate for mayor yesterday who was fired upon, you know, has talked about putting together, you know, community-focused policing. I think those things make a lot of sense. But, you know, I guess my question is, as Gene said, how do we fix this? I think that local government needs to be more like New York. New York City was forced because of the issues, all the people, all the variabilities in enforcing these vaccine mandates, and it worked. So I know where you stand, but where do you see the Metro Council in doing something more definitive or forward? You know, I'm trying to figure out how to say this. I'm just going to let you go.
Listen, the easy answer is if you work for Metro government, then you ought to be, and the Metro government says that you have to be vaccinated, then you ought to have to do that from my perspective. Now, do I see anything significant changing anytime soon? I don't see that there's any appetite for that at Metro Council. I could be wrong about that. I'm not on the Metro Council currently, and so I don't talk to I have talked to some of them here and there, but I don't see them and talk to them every day. But I don't get the feeling there's an appetite for that. I think many of them certainly agree with us that those numbers are way too low and that encouragement has not worked. And so I think many of them think that the right thing to do is to mandate that city employees be vaccinated. But I don't know that there's any appetite.
I'm afraid if you do that, the legislature is going to overrule you. There's a bill in the legislature right now trying to do away with all mandates for schools, including vaccination and masks. And it essentially says that the Board of Education cannot mandate any of those.
No, I agree with you. I think it's if that were to occur, I'm sure the state legislature would take some sort of action. And that bill that you're talking about, as it relates to schools, I have kids in JCPS, and that is an irresponsible and dangerous thing to do. I mean, to me, it's scoring short-term political points as it relates to people who think that, again, that their individual freedoms are being trampled on. But does Senator McConnell really think that's a good idea? I mean, he's the top dog on the Republican side, and I don't think if you asked him and he was being candid with you that he thinks that that's a really good idea.
Well, instead of focusing on a lot of the negatives, let's talk a little bit about something positive. I'd like to get your thoughts about, the Kentucky One collapsed, and the University of Louisville, under the leadership of President Beneputi, put together a program purchasing basically the assets of Kentucky One, which included Jewish Hospital, Fraser Rehab, St. Mary and Elizabeth, Lady of Peace, Jewish Hospital in Shelbyville, medical centers east, northeast, south, and southwest, and all the physician groups that were affiliated with those. They worked out this arrangement with the Kentucky Economic Development Finance Authority for a $50 million $20 loan, half of which could be forgiven, and then put together with the Jewish Heritage Fund for Excellence and Jewish Hospital and St. Mary Elizabeth Foundation for another $40 million, and basically stabilized healthcare in Louisville. And we had Wayne Tuxson, I'm not sure if you know who Wayne is, on the show a good while ago, as a private practicing physician in one of these groups that got affiliated with U of L. I was on the faculty for 30 plus years, and they managed to incorporate all of those entities, plus the private practicing physician groups, and integrated them with academic physician groups, and it's all turned out very well. So it's kind of a softball issue, but I would
it
like
is,
to
and
get your thoughts.
It would have been a much more difficult question. I mean, listen, the answer I would have given you in November of 2019 when this deal took place would be the same answer I would give you today. But it's so much easier to give that answer now, having seen how it worked out. I mean, would you do that deal to save immediately 6,000 jobs, good healthcare, good paying jobs of Kentucky One employees, which is how many employees were under threat of losing their jobs? And would you do that deal? You would absolutely do that deal all day long. So this one is a little bit of a softball. I mean, it is amazing what U of L has been able to do. I think they were losing $43 million. I think I wrote down $43 million a year Kentucky One was losing, and U of L was able to turn that around and make a small profit within the first year, in addition to the what was almost a seamless transition, what seemed on the outside anyway like a seamless transition. I don't think that story gets as much media time as it deserves. I don't know.
I agree. I absolutely.
I don't know that people fully understand what that deal accomplished and how many jobs and how much access to healthcare that negotiation made happen. And let me just say, by the way, the former governor, Bevin, who I disagreed with on almost everything, and particularly his tone and his approach to politics, you have to give him some credit too. He was part of helping make that deal happen. And so people that don't want to ever give him any credit for anything should at least acknowledge that he was there when.
And we need to acknowledge Jason Smith, who played a really big role.
He
happening.
did. Yeah, and I don't know if anyone watched 60 Minutes 2 weeks ago, but the second segment of 60 Minutes was on U of L Hospital and the nursing issues and the COVID issues and the the whole adjustment of providing health care in a pandemic where people who have got different forms of cancer and other medical problems have to wait in line or spend hours sitting around an emergency room before there's no beds.
I was going to say, let's bring that back around to social equity and access to health. Can you imagine what that would have meant for populations who already don't have great access to healthcare if Jewish and Kentucky One and all of those facilities had been allowed to be shuttered? I mean, you're right. You talk about rationing healthcare. We would not have had enough facilities for the people that could pay for it, much less the people that couldn't.
And we could not have managed the COVID-19 problem.
That's right. Well, let me just focus on another, I think, what I would consider a healthcare positive. Number one, I think the governor did an outstanding job in spite of the legislature in managing this pandemic. And the local health organizations, Norton Healthcare, Baptist, and U of L, who are generally in competition with each other, all collaborated in an assortment of ways to keep healthcare in Louisville do it as well as you could do under the circumstances. And again, in a sense, this is another softball question for you. I mean, I'm sure you recognize that. I'm not sure how much local government was involved in that. If you have some thoughts about that, I'd appreciate it. I think the listeners would like to get a sense of where local government would fit in the integration between the activities of these three healthcare organizations in Louisville.
I can't pretend to know how it worked on the ground, but certainly in theory, what should local government do in that circumstance? They should be the umbrella organization that organized all of those normally competing groups to work together. But I can't pretend to know how it worked actually on the ground.
Go ahead, Gene.
We're running out of time, so I want to ask you a difficult question. We have another epidemic going on in Louisville. The homicide rate is sky high. There's even an article in the Courier Journal yesterday that the coroner's office was being overwhelmed. How do we deal with this, and what can Metro Council do to try to solve this problem?
Well, I think the first thing that has to happen is that we have to focus on rebuilding the trust between the LMPD and the citizens of Louisville.
Yes.
I mean, without that trust, then that badge doesn't mean anything. That uniform doesn't mean anything. That gun doesn't mean anything. And this is complex because you have, on one hand, the FOP, who takes very, very hardball what I think seem, from my perspective, not to be common sense approaches to negotiations that would help the rank and file officers. Like you said earlier, Mike, being a police officer is an inherently difficult job, and it should be all of our responsibility to try to do everything we can to make that job less hard. And I feel like you've got the FOP, in one sense, working in a counterproductive way for us to be able to make the job easier for the rank and file officers. When you talk about how you rebuild that community trust, the first thing you have to talk about is accountability. And the FOP has pushed back on police accountability at every turn. And you have to look at accountability a couple of ways. I mean, I see it as, if I'm a accountability is helpful for police officers to do their job. If you're trained to do a certain job and you're doing that job the right way, then having a body cam on you, accountability, one form of accountability, that makes your job a little bit easier, because nobody's going to question what you did or how you did it when there's footage of that being there. So I think, I hope that this Department of Justice investigation into the police department, I think it's an enormous opportunity. You don't ever want to get into a situation where the federal government has to come in because things are not going well. But now that the federal government is here and is looking into it, I feel like we have an opportunity to address some of these things. But I have to be perfectly honest. And I had this conversation this morning with someone who's very familiar with it. Until we can figure out a way to get the FOP to back away and not be as intransigent on some of these issues. The FOP and the LMPD are linked. In people's minds, you cannot separate those two things. And the reputation of the FOP among the citizens of Louisville is not strong, and therefore it sullies the reputation of the LMPD. So how we get them to participate and to agree to accountability in exchange for higher pay. Do I think police officers should be paid? Absolutely. We start at 45 and police officers in Cincinnati start at 65. It's not right. And then another thing, I'll just say one more quick thing. We used to be able to keep police officers for a long period of time, in part because they had a really good pension system. And when we cut the public pension system, the police officers used to stay for 20 years, if for no other reason than there was the pension at the end of the road that was there for them. And so we kept police officers 20 years. Once they cut that pension system, there's no longer a reason for them to stay.
Was the pension system cut by the state or the local government?
State.
Okay.
Andrew, we're down to the last 5 minutes. I want to kind of change the focus a little bit here. Something you had alluded to earlier. We are all members of an organization called Kentuckians for Single Payer, and so I'd like to know your personal views, and you've shared that with us somewhat already a little bit, both from as a personal standpoint, as a potential public servant or someone in public office, the prospect, what your views are about the if we were to have a single payer system in this country, the ability to provide health care to the metro government, to the west end of Louisville, as opposed to this insane complex system that we have today, which we've got, I don't know, somewhere between 60 million people who are either uninsured or underinsured. 60% of the bankruptcies that are filed in this country are filed, by people who can't pay their medical bills. So let me let you express or share your thoughts about the potential or the benefits or the situation that we might be in from a health delivery system as a public servant if we had a single payer system that was run by the federal government.
So there's a lot there.
Well, you have to talk fast. You don't have a lot of time.
Time's running out. Let me ask you a really, really complicated question and see if you can condense that into 2 minutes. I am very much a firm believer that capitalism is the best economic system because it's so dynamic. But with that said, you have to take care of the people that fall out of the bottom of that system. If you don't do that, especially in a social democracy, then you're going to end up with pitchforks in the street, right? You have to be able to take care of people. People have to feel like they're participating in your economy, your capitalist economy, enough, at a certain level where they can take care of their families and feel good about the work that they do and all of those things. And there's no single thing that we could do to better take care of lower income Americans than provide healthcare coverage. before we talk about universal basic income, which I think is an interesting idea, but before we get into anything along those lines, the most helpful thing we could do for lower income Americans, and frankly, others like me who are self-employed and don't have really good access to healthcare either, but the single thing we could do as a health safety net for people is to provide that. Let me give you a very specific example of that. When I was growing up, my mom was an apartment property manager, and she managed, mostly B and C properties. And it got to the point, for a long time, her policy was anybody who had declared bankruptcy, we would not rent to. And it got to the point where so many people that applied for apartments had medical bankruptcies on their record that we basically had to, two reasons. My mom wanted to do what was right, but also what was fair, and also what was in the interest of the business. She had to say, we are going to rent to people now that have medical bankruptcies because there were so many people in that population that we couldn't afford not to, if that makes sense. And that's just a very specific real estate perspective into medical bankruptcies and that sort of thing. I know
major problem. Andrew, this has been great. We're at the end of the lollipop here. Mark's going to do his usual final scenario. We thank you very much for coming on. I've certainly learned a lot, and we wish you good luck with your campaign.
Thanks, guys. I really enjoyed it.
Thank you, Andrew. It was very enjoyable.
Thank you
so much. Again, WFMP 106.5 Forward Radio does not endorse any particular candidates or pieces of legislation, but we do endorse the need for an informed electorate. As such, we offer equal airtime to all registered candidates for any particular office. And you can get in touch with us at forwardradio.org. I'm Mark McKinley, a volunteer with the station. Thank you for listening.